Hello, everyone. Before we get started with the webinar today, we do want to acknowledge Association of Recovery Schools and give, I believe, the Michael Derslag a moment to introduce himself and introduce ARS.
Hi, thank you, Jordan, and thank you, Peer Recovery Centers of Excellence. This has just it's an honor to be partnering with you all to kind of bring this information to even more people. My name is Mike Derschlag. I'm the board chair for the Association of Recovery Schools, and I've been involved with ARS since 2015. I am the director of Pease Academy, or Peers Enjoying a Sober Education, which is in Minneapolis, Minnesota, and it's the longest running recovery school in the U.S. currently. So the Association of Recovery Schools it was formed in 2002, as you can see, and really our goal is to support schools, both emerging schools that are just getting started and providing them technical assistance and the support they need to successfully open and sustain themselves, as well as providing continuing technical assistance and support for our ongoing schools, those who've been open. It's an all volunteer board, and we serve the schools as best as we can and actually do a really good job. If you're at all interested in finding out more about the Association of Recovery Schools or becoming even an individual member, please reach out to me and I'll put my email and contact information in the chat. But I'm really glad you're here, and I hope to hear from you all soon. Thank you.
Thanks, Michael. And next, want to give everyone that will be talking today a moment to introduce themselves. Start. My name is Jordan Drinsky. I'm a PhD student at Vanderbilt University and a person in long-term recovery that has been able to be a part of this work recently and is currently the project director of the SEERS project, which we'll talk a little bit more about later. And then I'm going to kick it over to members of the panel today. First, Sharon, if you'd like to introduce yourself.
Sure. Thanks, Jordan. I'm Sharon Dorsey Martin. I'm the founding principal of Harmony Academy out here in Portland, Oregon, and the board secretary for the Association of Recovery Schools, and also a person in long-term recovery.
Michelle? Oh, Rochelle, you're still muted.
Sorry. I am Rochelle Gardner. I am the executive director and co-founder of Hope Academy, which is the recovery high school in Indianapolis, Indiana, and have served on the board in multiple capacities and currently just serve as a board member.
And Andy?
Hi, everybody. My name is Dr. Andy Bench, and I'm a professor at Vanderbilt University. I'm also one of the co-founders of the Association of Recovery Schools, and I currently serve as the founding senior advisor on the board of directors. Glad to see everybody.
And then not listed today is also our new addiction recovery research assistant, Ariana Riccio. I'd love to have her introduce herself briefly as well.
Thank you, Jordan. Hello, everyone. My name is Ariana Riccio, and I'm also a PhD student at Vanderbilt University. As Jordan mentioned, moving forward, I'm the new research assistant for the SEERS project. So my role will be to serve as your point of contact for anything that you may need. So please do not hesitate to reach out. And I'm looking forward to working with you all and getting to know more about you and all of your schools. Thank you.
Thanks, everyone. And just a short overview of the agenda today. We're going to talk a little bit about data. What is it in the first place? Move into history of data within recovery high schools, and then hear from Rochelle and Sharon about their schools and how they've implemented data. And then we'll also have a brief breakout room activity to brainstorm what's currently happening in your schools and how you can see data being helpful moving forward. So I want to start by talking about something we hear a lot about, but might not fully understand: data. Well, what exactly is it? Let's first look at the definition from Merriam-Webster. Data are factual information used as a basis for reasoning, discussion, or calculation. In simpler terms, think of data as pieces of information. It's like the ingredients you need before you start cooking a meal. Without those ingredients, you can't start cooking. Similarly, without data, we can't begin to understand or solve complex problems. Now, there are two main types of data: qualitative and quantitative. Qualitative data is like observing and describing the color and shape of apples and oranges at a grocery store. It's about characteristics, descriptions, and observations. On the other hand, quantitative data is about numbers. For example, counting how many apples and oranges are there, or measuring their weight. Both types are important. Qualitative data helps us understand the what and why, while quantitative data tells us how much or how many. In everyday life, we use both types of data without even realizing it. When you check the weather forecast, you're looking at data. When you rate a movie online, you're providing data. So as we dive into today's topic, let's keep in mind that data is all around us. It's in the little details and the big numbers, and it helps us make informed decisions in almost every aspect of our life. Diving a little bit deeper into qualitative and quantitative data, the two types mentioned earlier, qualitative data, again, is all about descriptions and characteristics. It's like painting a picture with words. For example, if we're looking at recovery high schools, qualitative data could be the stories and experiences of the students. It's their feelings, their opinions about the school environment, or their personal experiences with recovery. This data helps us understand the why and how behind their experiences. It's rich, detailed, and very human. Now let's look a little bit more at quantitative data. This is the numerical side of things. Again, it deals with quantities, amounts, and measurements. In the context of our topic, this could mean statistics like the number of students attending recovery high schools, their attendance rates, or even the percentage of students who continue their recovery after high school. Quantitative data gives us the how many or how much. It's about counting, measuring, and using numbers to find patterns or make comparisons. Both types of data are crucial. Qualitative data gives depth to our understanding, while quantitative data provides the breadth and scale. Together, they offer a comprehensive picture that allows us to make well-informed decisions and understand the world around us in a more meaningful way. But no single piece of data or approach will tell the whole story. But data can be very useful in understanding and supporting recovery high schools and their students. So today's webinar has 4 overarching learning objectives. First, help understand the significance of data in recovery high schools. 2, recognize practical applications of data in recovery high schools. 3, identify available tools and existing data. And 4, plan for future action and training. And with that introduction, I want to kick it over to Dr. Andy Finch to share about the history of data.
Thanks, Jordan. One of my roles with ARS is basically resident historian, because I've basically been here from the beginning, and that beginning was in 2002, and data has been a part of our organization really from day one. And even before we existed, we were reaching out to schools across the country to try to understand what they were doing, what kind of programs they provided, and how they staffed their schools, all of those things. And so an outcome of that very first meeting that we had in 2002 in Washington was a report that described the schools around the country. One thing that we found was that all of the schools wished they had a better way of looking at their programs and looking at their outcomes. And at our third conference, there was actually a presentation from an RHS administrator, and you can see this on the slide. Lyle Typula had created an entire spreadsheet and a program for schools to implement. And one thing that we discovered very early is that the schools were doing so much, the staff was so stretched that the idea of collecting data, as much as they may like it, was intimidating. It was a lot of time. And so this dilemma arose from the very start, whereas our schools want data, they are collecting data at a certain level, but how to use it, how much time to dedicate to it has always been a question. In 2005, you all may be familiar with the global appraisal of individual needs. Well, the people that helped create that instrument came to our ARS conference and offered the use of the GAIN basically free of charge to any member school that wanted to use it, wanted to put it into practice. And some of our schools have been using it since that time, but there's different versions of the GAIN. And again, this sense of how much time do we have, how much can we dedicate to using this continued to be an issue. And I would say most of the schools did not really take them up on the offer, especially to use the longer, more comprehensive instrument. We were fortunate enough to get federal funding for a couple of different studies over time. One of those was very descriptive. As Jordan said, it was a qualitative study in which we went around and visited schools all over the country trying to categorize them. We did a survey of students at that time, about 300 or so students, but it was a very focused, in the moment, again, students basically describing themselves. There was no follow-up. no way to really gauge outcomes. In 2007, again, this is only 5 years into our existence. I went back and I looked at the program. There was actually 4 different presentations, and they're listed here on the slide, that actually looked at research, that looked at data that people were collecting, and also how they were using the data in their schools. And so, again, you can see this as a priority of the organization. But I will just say it was still very slow to take on, in part because of how much time it might take, and perhaps maybe some concern about what schools might find if they look too close. And this tends to be a problem in programs, and especially treatment type programs historically. And then you'll note the last bullet on this slide was really the first major outcome study that was conducted, and this was funded by NIDA beginning in 2011. And it was a study that took over 5 years and actually enrolled about 300 plus students, and has produced numerous publications from that work. Next slide, Jordan. Again, to that point, though, this was not something that all of the schools were necessarily participating in. We continually, way back to the beginning, tried to find a way to get schools to systematically collect data, to look at what they were doing, to find tools that would measure student success and help us build an evidence base for the schools. And fortunately, we did have some of the studies that I've mentioned that created somewhat of an evidence base to build standards upon, but really nothing systematic across all of the programs. And one of the things that came out of COVID was a real desire to meet online regularly. And we had an administrators cohort that started meeting regularly. And not surprising, those administrators really prioritized creating an instrument that would be consistent, that schools could just implement. We found that schools were collecting various forms of data, but they wanted to find a way to find an instrument that would be both consistent and available to the schools, but also was measuring recovery high school outcomes that was relevant to what they were doing. And so you could see the developmental timeline here, starting back in instrument development way back in June of 2021. And this really came from asking schools, what are you collecting already? What do you want? What is available out there that we could work with? Harmony, which is Sharon's school, was kind enough to pilot that instrument and give us some real feedback from students about what they liked, what was challenging. The staff was able to give us some feedback on the instrument and actually implementing it. And we've continued to tinker with that since that time, all the way up until this fall, looking at the instruments, looking at the process. And this will continue to be an iterative process over time as we figure out the best scales and the best process for people. The second half of the slide I want to highlight is that we actually did create a school-wide survey as well. So the survey, the SEERS instrument that I've just been describing, is for students. It is to talk about student outcomes. But back in 2015, we actually started sending out a survey to school administrators that was describing the schools. How many students do you have? How many staff do you have? What are your demographics? What are your enrollment procedures? These kinds of things. And we have been continuing to administer that, especially over the last couple of years, once a year, trying to get feedback at the school level. And so the SEERS is both a school level, describing the programs, as well as a student level, describing the students. There's 2 different surveys that exist at this point. Next slide. So that student instrument that I've mentioned, that's looking at specific student outcomes, you can see there are a number of scales that are built into the instrument. And the probably main one, and this is really coming from the administrator's desire to look at recovery capital, is a scale that measures recovery capital. And there's a number of different scales built into that you can see. Recovery capital is a pretty broad construct, but the SEERS instrument does measure recovery capital. I'd mentioned the gain a little bit earlier. We do include a short screener of the gain in the instrument. There's a quality of life and life satisfaction scale. We're trying to understand positive youth development, which is something that in the field of working with young people is a widely accepted measure. Harmony Academy, Sharon School, had started to build an assessment as well that was modifying some of these instruments. So we've taken some items from that, and we continue to work with the instrument to find items that are reliable, and that are valid to this population, to adolescents. And honestly, that is probably the biggest challenge that we face, because a lot of the assessments in this space are for adults. And so we're trying to find the way to do this best for adolescents. So I think with this, I'm going to go ahead and turn it over to Rochelle. One thing that we thought would be valuable for you all would be to hear actually from administrators who were using data and have been using data. And as I mentioned, Sharon's been using data. Her school is newer, and a lot of this has been helping us form and implement the SEERs. But for Rochelle at Hope Academy, they've been using data for many, many years in a variety of forms, long before we ever had the SEERs instrument. So I'm going to turn it over to Rochelle to talk about what Hope Academy is doing.
Thanks, Andy. Again, I'm Rochelle Gardner. I'm the Executive Director of Hope Academy. This is the front of our school. And yes, we have a school bus because we offer transportation, but we opened our school in July of 2006. We are a charter high school, so we're a public school. And we've been open this is our 18th school year, so we've served over 800 kids through our school during that time. Our average enrollment is around 40. Of course, during COVID, just like all of us, that enrollment took a hit, but our average enrollment is about 40. We serve over 30 different school districts in the 9-county area around Indianapolis. If you're familiar with Indianapolis, it's kind of the center of the state. And we serve 9 different school districts in about 6 different counties. Our current graduation rate is 85%, and our average attendance rate is about 93%. I think, and I tell you those 2 statistics because everybody wants to know your graduation rate, because apparently that's how we measure success, and it is important. However, all of our states are a little different. In the state of Indiana, you have to graduate within a 4-year cohort. A lot of our kids come to us outside of the cohort, so it doesn't necessarily, graduation rate doesn't necessarily tell our success, but attendance does tell our success, okay? Our average student that comes to us was attending school about 30% of the time. Prior to coming to a recovery high school. And our average attendance rate is now 93%. And I'll go into a little bit about what does that mean and how does that rate into some of the data and how you can use that data here in a minute. Okay, Jordan, you can move the slides. So as Andy said, we decided, one of my co-founders who's passed, but he was a PhD, and he said, we're going to collect data from the time the kids walked in the door. And I'm like, okay, well, what are we going to do with that? And he's like, I don't know, but we're just going to collect it. And so over the time frame, what we started collecting and what we currently collect is some is the same and some's a lot different. But I will tell you, if you think back to what Andy was telling you about how they created the SEERs, a lot of the things we were doing were things that, we had to pick and choose from other data sources that now are in the SEERs, which makes it so much easier because it's one survey we have to give instead of several different surveys and have a calendar of when we're doing the surveys. But some of the key ones, our first data package for probably the first 8 or 9 years, we did the NWEA, which is an academic test. Those of you who are in academia know that it measures measures reading, language, and math skills. That was one of our academics. The GAIN-SS short screener we did, and we did the developmental assets profile. Academically, we looked at attendance, we looked at credits earned, we looked at discipline referrals, we looked at end of course assessments, which was what they took. We don't do those anymore, but what they took that said they've passed that class. And the recovery data, we looked at what's their meeting attendance, what's their sponsor contacts, what activities are going to their recovery related, what is their absenteeism, what's their recurrence of use. Those were all things that we looked at. Once the SEERs came on, we could then take away some of the assessments that we were doing, but also then look at some different ones, right? And I will tell you that the SEERs data profile really helps you tell who your student is sitting in front of you. So some of that data, when you talk about collection of data, even if you don't know what you're going to do with it at the time, I will say it's important to just collect it. if someone's asking you the question, you might think, okay, should I collect that? And what kind of process am I going to have to do to put in place? But will that be useful data at some point? Because you're always going to be asked that question at some point. Okay, Jordan. So, like I said, we've worked with ARS to have common data collection. It's key. The dashboard, we use a dashboard, and that we report to our board. We use it for our authorizers. So we're a charter school, so we're authorized by the mayor of Indianapolis. We also use it for grants. Okay. And so we look at things like, what's our enrollment by grade, gender, race, ethnicity, grade distribution, how many freshmen, sophomore, juniors, seniors do we have? Because when you look at that as a whole, or you look at it as a staff, or you look at it as a board, it really kind of tells you, if you're heavy boys and you're heavy freshmen, you probably have more of a middle school feel to your school right now. And it really helps you then frame what you're going to do academically and recovery, right? Where are the hot spots? What do you need to look at? Attendance rates are key. Okay. Attendance rates are probably one of the best marketing tools we have. Okay. Because if you have kids coming to your school that are coming to school 90 to 95% of the time, here's what you can say about them. They feel safe in your school. They feel engaged with the people in your school. They feel engaged in learning. Those are all key buzzwords, key things that people want to know and you can tout your success with, right? We look at enrollment by county. Where are our kids coming from? Key, because there's different people you can go talk to from the different counties. And we note our special ed enrollment because that can be expensive. It can also be taxing on your staff. And if you don't have somebody dedicated to it, there's just a lot of things that go with that. And so we look at that, and our special ed population fluctuates anywhere between 25 and 40%. When you have a small school and you have 40% special ed, that's a lot of special ed going on. It's a lot of IEPs, a lot of different tracking that you have to track. So we look at the free and reduced count, right? There's lots of reasons for that. There's grants out there for people that, that really hits us with our lunches and things like that. And so if there's money out there for that, we have a high free and reduced count. We can look at funding that in different ways. We also, because we're a recovery school, feel like we should monitor what's happening in the recovery and wellness classes. Our kids and it's not just participation, it's not just doing the homework, but it's also how many recovery activities are you going to? How many meetings are you going to? How many alternative peer group meetings are you going to? Those kinds of things, because it's all about engagement, right? Engagement in recovery is engagement and change. And we can monitor it all, but these things are things that can help us move the dashboard with them, move the needle with them, of moving them closer to a state of recovery. Okay, do I have another one, Jordan? No. Well, before Sharon talks a little bit, I think it's just important to look at those key things, and what changes is what monitors changes, right? And so don't monitor things that you don't want to take on, but keep collecting the data, because eventually you might want to take that on. That might become a key change for you. I am not a data person like Andy is, but I can appreciate the importance of it. I can appreciate what it tells me and what the message then can be for parents coming in the door, for referral sources, for grantees or grantors, for legislative people that walk through the door. Everybody wants to know what your data is. And so it's important to be able to say it, and say it with confidence. If you have a whole lot of it, then you don't know it. And then they think you're not really doing it. So I would say keep it within what you can speak to, and speak to it with, confidence, and use it for change. That's what I have.
Yeah, oh yeah. Hi, everybody. I'm Sharon Darcy Martin. Thanks so much, Rochelle. So One thing that you'll be able to tell from my slides is that I'm a very visual person. I also really love the adolescents that we serve in recovery high schools, and I hope you see that in the picture. So just on a really personal note, the reason that I got into recovery myself back in 2006 when Rochelle's school was opening was that I realized, I had this realization at a certain point that no matter what was special about me or any of the people around me, all our stories were going to end up exactly the same. Addiction just turns everybody's stories into exactly the same story. And so now I have the privilege of working with young people who are authoring their own stories, who are going from sad statistics to visions of hope. And data is the way that we get to tell that story. And so that's why it's important to me. Like Rochelle, I'm not naturally a data person, but I do like storytelling, and this allows, data allows me to do that. It's really important, as Rochelle was saying, to measure what matters. And so for school leaders, we decided, for RHS school leaders specifically, we set up SEERS, and we worked with Vanderbilt, and we worked with other people to just try to measure what is success for young folks in recovery. And people want to just look at, how many days do people have free from substances, which is part of it. Continued abstinence is part of the picture, but there's so many other parts of young people's lives that move forward as they engage in that brave process of recovery. So on this first slide, I just wanted to show some of the very, very basic data that people ask for. Graduation rate is always one of the top ones. And this is just, whenever we talk to people, they want to know this right away. Jordan, could you advance the slide? And then there's data that establishes the context in which recovery high schools operate, and how we are placed in the larger systems of care. So this is depressing but much needed data from something called the Lund Report out here in Oregon. And it showed last year that for the 40,000 or so youth with substance use disorder, there were under 40 beds for residential treatment. There was 0 youth detox, 1 recovery high school. And then my least favorite fact on here is that for every 2,400 secondary school students, there was 1 drug counselor available. So I use this kind of data in presentations. Could you advance the slide, Jordan? And then there's data that I used for grants, and Rochelle was sharing about that. So I just shared, this is the first paragraph, and I highlighted the data that I used in the first paragraph of the first question of a super competitive grant that we got. And so I use the data to share the size of the problem in our area, in our city, in our counties. I look at school data, health data, federal economic reserve data. And after describing the problem with the data, I get to describe the solution, and SEERS helps with the data for that part of the response. Could you advance this slide? And then when we get the grants, we have the responsibility of reporting back with data about just how we're using those funds to improve the lives of adolescents at risk in our areas. So some of the markers are obvious, like that last one, number 5, award Oregon diplomas. That's an easy metric for us. But that first one, provide a recovery-centered, academically engaging environment as a school of choice for adolescents in recovery. We have to decide how we're going to show that. And the way that we tell that story is really, really important. One of the things that I like to show is that recovery capital. That's sort of something that we have to give people a little bit of background on. But positive youth development is something that's measured in SEERS, and that's something that generally the audiences that I talk to understand that. They also understand lessening risky behaviors. That's something that we can show with the SEERS is, how kids are moving away from some of those criminal activities, from drug use, from internalizing and externalizing behaviors. And then, just how they're growing in satisfaction with their lives. That's really, really important. And that combined with the graduation data and combined with the attendance data, like Rochelle was sharing, that starts to paint a picture of what's happening inside of our buildings. Could you move ahead on that? Thanks. And then sometimes data can help us get objective information about something that's really, really emotional. And so this is data I collected to prepare for a presentation We were invited to speak to the Attorney General at a fentanyl convening. And so I just went and collected some information from the students in our building. And I got to share this information again last night. We were invited to speak on the news about fentanyl. And, we get to share what about this is important. We get to use it in addressing the needs of our students in the building and also representing their needs outside of the building. So, the good news on this sheet is that, 1 out of 5 of our students have reversed an overdose using Narcan or naloxone. That's being part of the solution for kids that are in recovery. They get to save lives. On the downside of this is that, 62% of our kids have lost a really close person in their lives to fentanyl or opiate overdose. So I am looking at the time. Could you move ahead a slide? Thanks. And then the Sears student level. So that it helps us evaluate our program. It helps us communicate about that outside of the building. And so I always use Jordan's data. I call it Jordan's data, the Sears data. Thanks, Jordan. To situate our 33 students within this larger set of hundreds and hundreds of students that we've surveyed across the country. And so, for example, speaking of fentanyl, 11% of our kids listed that as their drug of choice. And that's kind of commensurate with the 10% on the Sears survey that did that. But it doesn't end the conversation there. I get to take the conversation then out of that really narrow fentanyl lens that people have right now to talk about how almost 25% of our youth are using whatever's available. And so then we get to have a discussion about that. And then we get to take it back to what do our students need to tell this story of recovery and wellness and continued health and increasing health. And then the Sears school level helps us look at it from an equity lens. So I'm going to stop talking. This last slide here, I just wanted to get people thinking in the audience here about what stories they want to tell and what they might want to ask the data to measure. And when we see what other people are measuring, like I get to call Rochelle now and say, how are you getting a 93% attendance rate, Rochelle? So when we measure what matters, we get to ask the people who are doing it well, we get to look at where our own programs can grow, and we get to keep doing really good things for youth and keep the story going. So thanks for letting me share.
Thank you all. It doesn't matter how many times I hear Sharon and Rochelle and Dr. Finch share about their work. It gets me excited every time. Just amazing work. I'm really grateful for everyone being here. We're going to pivot a little bit to have some facilitated discussion. And so I'm going to post a link in the chat for a Google Jamboard. And if you've never used one, it's basically a virtual whiteboard. So you can click on that link that's in the chat, and it'll take you to the Jamboard, where we're going to be broken up into breakout rooms. And so in a few moments, you'll get a little message on your Zoom screen inviting you to join a breakout. So go ahead and join that breakout when it comes up. And in that small group, look through these questions that are on the screen, and they'll be in the Jamboard as well, and have a conversation. What are you currently doing within your organization to address data or use data? What gets in the way of doing more with that data or doing more in your organization? Or what is one thing that you'll take away from today? And so we'll spend about 5 to 10 minutes in this in the breakouts, and then come back and reflect. And so we do ask one person within each group to volunteer as a scribe. So you'll just double click inside of the sticky note that you'll see in the Jamboard to start typing.
Are you all set for the breakouts? Okay, I'm opening them. I see a few of you are still with us. Raise your hand if you're having a trouble joining a breakout and I can put you in one.
There may be some that are in a position where they're listening to the
Yeah.
webinar today, but they're unable to join, or it's not safe to click through.
Exactly.
And then let's see. Broadcast message.
How many breakups did there end up being, Cindy?
I did 10. There were 47 at the time that I started them. So
Great.
there's at least 3 in each one. I've been checking so they have, make sure they have somebody. Room 4 only has 2 people, but. Oh,
Jordan, should we pop in there?
Yeah.
No?
I think so. Yeah.
Okay.
And then Cindy, can you help keep track of time so that
yeah, we start.
Oh, go ahead. Sorry.
We started 11:39. You said 5 to 10 minutes. So
See, let's come back at 40, 45, 46.
7:45. Perfect. Perfect.
Great. Thank you.
Yep. Hi, Daniel. I'm going to see if I can put you in one. Hmm.
Welcome back, everyone. Just working on getting the screen share back up. Great, and thanks everyone for participating. And I love seeing the Jamboard and the notes, and you'll have access to that for the foreseeable future if you want to come back and look at others' notes and reflect on your own. But I do want to take a few minutes to provide space if anyone would love to share. I'd love to hear from at least one or two groups about what they talked about and any common themes that came up in the discussion. And you're welcome to raise your hand or unmute yourself and go from there. I can start with our group. We started talking about the connections of resources and figuring out what youth need, and then also thinking through experiences of COVID and post-COVID and how data, both qualitative, the experience of young people and teachers and families can support positive change and figuring out what needs to be put in place to support students and families and communities going forward. Would someone else be willing to share a little bit about what they talked about?
I was trying to hear somebody else's voice, but if somebody else wants to jump in, I could certainly share in our group that time and capacity were two issues that seemed to came up, and really using basic tools like an Excel sheet versus having some type of centralized database that was maybe a little bit more tailored for the program was another barrier.
Yeah, and something that I'm seeing both on the Jamboard and through conversations that I've been having for a while is just, and Rochelle mentioned this when she was talking as well, as like, how do you define and measure success, and what does that mean? And so it's really useful to be able to have data to be able to support a holistic understanding of what success is for youth and recovery high schools. And really part of the usefulness of data in this context too is shifting from one outcome measure or one aspect of success to being able to look at it more holistically. And with data, we can show that and really highlight the stories of youth, and as well as the quantitative piece.
And I would say to piggyback on that is that if you don't define your success, they will define it for you. And so you need to use your data to say what your success. Everybody asks me all the time, what's your success rate? And what that means to them is how many kids stay clean and sober. Well, that's not how we measure success, right? Measuring recovery is part of it, but there's also a lot of other recovery capital and human capital things that mean success. So what does that mean? And we define it versus allowing other people to define it for us.
Great, thanks, Rochelle. And so important to tell your own story, the story of your students and the story of your school, and data can allow you to do that and back it up.
Lindsay has a hand up.
Can I just out of curiosity, there's a lot of changes kind of coming in the recovery field around like harm reduction, things like that. And we are like trying to get some of those measurements changed. Do you see those affecting and like taking effect in recovery high school data as well? Like, I guess they're getting better defined what recovery is and how to figure that out.
I could tackle that. I feel like, one of the reasons we lead with recovery capital is just that. The two things that you can look at, and especially if you look at all the different scales that we've included, I would say most of the scales don't focus on substance use specifically, and we're certainly getting at that. But reduced days of usage, what substances has someone been using before they come into school, but just looking at general wellness categories and the different types of community, social, recovery, financial, all these different issues that are looking at, I think, the more current understanding of what recovery is and monitoring progress in that space. So I think certainly the SEERS itself was created with that in mind, but I just think the field itself is steering, like Rochelle said, away from an abstinence only measure to looking at a more broad view of what recovery is. I also want to, say to that, I think a lot of this conversation today has looked at school level. How can we use our student data to talk about the school? I think we need to also realize that another way to use the data, and probably the most important way, honestly, is to look at student growth and to monitor how students are doing. So it's very important to have something that you're doing when a student enters a school. We call that baseline data. And then have regular follow-up data to show improvement, but also to have a plan to sit down with students, with a recovery coach, with a counselor, a teacher, administrator, whoever it might be, to go over that. And I think that's one of the things that, even the schools that have been collecting data to this point, finding time in the day, making sure that those follow-ups are happening regularly to look at progress. That's another plan that schools need to have and know how to process the data with the students themselves and have an instrument that you can give regularly.
And before we shift into questions, additional questions, wanting to just note that through harnessing the power of data, we're not just transforming recovery high schools, as Andy was just talking about, but we're shaping brighter futures for every student within them. And so it really is this both and conversation that I think will not only impact recovery high schools and the students within them, but the larger recovery communities and just communities and families in general. And if you're interested in trying the SEERS student, there's a QR code on the screen there that you can just take a picture of with your phone or use the link in the bottom, and it'll take you to the survey that we use. And you can put in code 99. You'll know what that means when you get there. And feel free to put in your personal email afterwards so you can see what an automatically generated student summary report will look like with this data and with the survey. Oh, I'll leave that. I'll also put the link in the chat.
Jordan, one of the questions that came early was about the recovery capital for adolescents scale. That's something that we're having a large part in creating. There is not an instrument right now that's been validated for adolescents. There are a variety of recovery capital scales that are available. We've been working with researchers such as Dr. Emily Hennessy to help create that scale. And in large part, some of the data we're collecting through SEERS is helping inform that conversation. And so I wish I could just send you a scale or a link to a scale, but honestly, what you see in ours is an effort to create that. And so we're one of the better parts of that development, but that's still in progress.
And it's been an amazing iterative process, both from the initial conception and cobbling together of these different scales. And as we continue to modify items to make them more developmentally appropriate and add or take away items and just make the survey better for schools and better for students. So at the end of the day, that's what it's for.
Do you guys have any data on, so I work as a peer specialist in that field, right? And I like a work program, and I'd be interested to see if you guys have any data on how these students step into the peer positions, because it seems to me that they would be perfect candidates to become, peer specialists, and how well they succeed as opposed to somebody who maybe doesn't have that experience at a recovery high school.
I can just share anecdotally, one of our first students ended up graduating and becoming a recovery high school peer mentor. And that's working really well.
I've had several alumni come back and work in the school as peer coaches. We are looking at, in the state of Indiana, for graduation, you have to have a certain pathway, and one of it is a career. So we're looking at how we can do some sort of certification for our juniors and seniors as they get ready to graduate.
One type of data that Jordan didn't specify is longitudinal data. And so, we could have quantitative data, but what it takes to really get a good answer to your question is tracking students over time. I think we can get to the point where we're tracking school students well within the buildings. Now we can really shift to tracking students well once they leave the buildings. And I think that's a really important question. And the best we have right now is pretty anecdotal or site by site. And I think that's something we need to work on developing.
And Lindsay, I think that's a great question, because one of the things that we've been working out with ROI is starting to test the whether or not recovery high schools and students in these schools would be up for helping to create a certified recovery peer specialist youth adolescent version, so that for the teenagers that are in the school before they graduate, they become peers on a certified track while they're still in recovery high schools to help other peers sort of initiate, the new ones into the group, to work through these surveys from one peer to another to get, to see if there's differences in the responses to the questions, that kind of thing. But then a track that allows them to turn into an adult certified peer when they graduate, directly linked into collegiate programs too. So we've had some discussions with collegiate programs that are willing to funnel this down. So I'd love to connect with anybody who's interested in that or sees interest in that. I'd like to co-produce this. But I think that that's a fabulous idea. We used to have stuff down here in Florida in the Choice program in Palm Beach County, where you would have conflict resolution peers. So they would be trained mediators, and these were fifth graders that were trained to mediate, conflict resolution inside of elementary schools. And that was such a great program to be able to do this in the high school settings. I think that they would both love to own, to help each other. They just don't know how.
Yeah, I guess I asked because what I see in the workforce is that we do have this huge need for, younger youth, going into the field, and it's hard to find. It just is, right? It's hard to find youth that, first of all, youth don't want to deal with somebody who's old, right? So we need to find somebody their age that really understands what they're going through in that moment, that they'll listen to. And I think that'd be a great resource.
Other questions? We have time for a few more, about 2 more minutes.
I just ask one of those harm reduction questions. It's completely off topic, but out of curiosity, for those of you who are in recovery high schools now on this call, is there Narcan on site at each of these locations that is accessible?
Yes, 100%. And we hand it out to parents at family night or families at family night. Students can access it whenever they want. We get it through a clearinghouse, so it's free to the school. And we just try to get it out into the hands of as many people as need it.
We do too. We also hand out fentanyl testing strips.
Excellent. Thank you. Satisfied my curiosity there.
Also, it wouldn't be a webinar about data if we weren't asking y'all to provide some additional data as well. So Cindy put a link in the chat for a brief evaluation of today's webinar. And providing this information not only helps us as like the presenters and panelists do better, but it also helps the Peer Recovery Center of Excellence, and it helps this work continue to be supported long term. So please, if you have a few minutes, take that evaluation survey. It really helps us know where we're at and what we can do better.
Thanks, Jordan. And thank all of you for a great presentation. As I mentioned earlier, you will get a follow-up email before Friday. It will have the slides for this presentation. We have recorded it and it'll be on our Vimeo channel. So I'll send you that link. And other resources that I saw mentioned in the comments will include, and email addresses, I think, maybe of some of our presenters. So everyone, have a great afternoon. Thanks so much. Glad you were here, and take care.
Thanks everyone for coming.